Day 2 of the nurses' strike, and there is a proposal now on the table that could bring an end to the walkout. Nearly 7,000 nurses at Mount Sinai in Manhattan and Montefiore in the Bronx are demanding more staff. Sat at the bargaining table all day yesterday trying to really find a compromise.
So this morning we're joined by Nurse Anna Reyes, who works as a floor nurse at Montefiore. Good morning, Anna. Thank you so much for being with us this morning.
Good morning. Thank you for having us.
I mean, let's get straight to it. What's the latest? Are you any closer to reaching a deal?
We're really praying. We're really out here praying that we do get a good deal this year. We've stuck through COVID. We've worked through this hard. We've done everything we could to make it work, and we have. But we've done miracles with the lack of staffing that we had, and now we feel like we can't do it anymore. We need the support of the community and the politicians and our patients to let them know that we need this contract as much for us as for them, for their safety.
We reached out to Montefiore for a statement on this. We're still waiting for a reply on their side of things. But for you, what's holding up negotiations from moving forward and kind of putting this to bed and putting this to rest? Is there something that is not happening?
Honestly, it seems like it's on Montefiore's table. We've put great proposals up. We've been doing it for months now. And it didn't seem as though there was any real movement until NYP started to make some action. And now we put this forward, and this is not what the nurses want to do. We want to be there with our patients right now. We want to be inside, but it doesn't look as though they're making any movement to get us any closer to the staffing or the funds that we need to make this work.
I mean, so are you lacking optimism at this point? I mean, especially when you're thinking about your patients that you care so much for that are still waiting inside.
No, we're ready to go back in. There's no lack of optimism. We love our patients. We want to go to them. We know that the people that are in there right now are trying their best, but they are not staffed with our patients. They do not know our community. They do not have access to a lot of the stuff they need to make the patients safe and healthy. We do. I'm here with nurses from the NICU and CICU. We know how to make our patients better. We have to be in there for them.
Yeah, and we know that staffing is obviously a big issue for you. You want to have more staffing. There's about 700 openings right now for nurses at that specific hospital. If there is a deal reached today, when do you head back to work? Is it immediate?
We would love to go back immediately. We are ready.
So as soon as a deal is struck, right? If there is a deal, how soon do you walk back in the doors?
As soon as Niza and Monty says, yes, we're doing it, that's as soon as we're coming in. We will come in our street clothes, in our scrubs, and whatever it is that we need to get back to work.
Well, clearly,
it's not being hindered by the nurses at all.
Well, your heart is clearly in it, and we wish you the best of luck. Nurse Anna Reyes, thanks again for taking the time to talk to us this morning.
Thank you. Thank you for your support. Bye.
Thank you.